Institutions across the country continue to fail Indigenous peoples, and all orders of government are responsible for this ongoing failure. We are encouraged by the federal commitment to tackle systemic racism and discrimination experienced by the Métis Nation and other Indigenous peoples in our health system. To inform this important work, we asked Métis Nation leaders and senior staff working in program development and frontline services to share their experience of systemic racism experienced by Métis in the health system and to identify actions required to address it.
When you talk about systemic racism or systemic discrimination in terms of the Métis Nation, we have the experience then that the federal government is not serving us. There is systemic discrimination and racism, so we do need to find ways and means of getting past that.
Despite being one of 3 Indigenous peoples recognized in Canada's Constitution, the Métis Nation has been systematically excluded from federal Indigenous health policy and programming. Research shows that Métis citizens and families continue to experience significant health disparities and higher rates of chronic disease, while at the same time having less access to basic primary care and specialist services.
In 2012, we produced our first health report based on 2010 data. So with that, we got kind of an overarching view of what some of our main health priorities would be.
And we know that compared to the general population, Métis citizens, as they age, have a much higher rate of chronic disease. Diseases like diabetes, heart disease, hypertension, arthritis, cancer.
Supreme Court of Canada decisions, most notably Daniels versus Canada in 2016, have directed the federal government to honor its fiduciary duty towards Métis. That has not yet occurred in the area of health. Métis citizens still are not afforded access to federal supports, such as the non-insured health benefits available to other rights-bearing Indigenous peoples.
In 1979, in fact, Canada created which was now known today, still haunting us today, as a federal policy where Métis will be excluded from the First Nation Inuit Health Branch. Daniels has settled that, but Canada is still behind. Canada needs to catch up. Canada needs to remove themselves that 1979 policy.
The fact that we still have a federal Indigenous health branch called First Nations and Inuit Health Branch, a title that makes no mention of Métis, is a stark reminder of the structural racism that still exists in our current health systems. It's appalling to me that despite the fact that the Métis Nation comprises approximately 1/4 of the Indigenous population in Canada, it receives less than 1% of the total federal funding for Indigenous health. This is not pointing fingers. I'm not here to throw around accusations. These are simply facts, unfortunate carryovers from the past federal policy decisions, oversights, and failures. But carryovers or not, if we are to be serious about eliminating racism in our health systems, racism that is continually and negatively impacting Métis people at all levels, we must begin by taking a long and hard look at the policy and legislative platforms on which such systems are built.
Even with the Daniels decision in 2016 that states that the federal government, has jurisdiction to deal with all Indigenous peoples, we are still not at a stage where, the Métis are being dealt with by the federal government. And the pandemic is one area that shows that. In early December, we had a teleconference or Zoom meeting with the Minister of Indigenous Services Canada, the Honourable Mark Miller, and officials with the department, including FNIB. And essentially the message was that with respect to the vaccine, that they will talk to the provinces to ensure that the provinces provide a priority to the Métis in terms of the vaccines provided to the province, and basically that, again, they're dealing with First Nations and Inuit in terms of their responsibility or jurisdiction. So again, here, the systemic entrenched attitude by the federal government and FNIB, has reared its head again.
When COVID hit, it was hitting a lot of our personal care homes and a lot of our smaller communities. You look at First Nations that are adjacent to Métis communities, they have nursing stations, they have nurses, but in Métis communities, there's no programming. You go to personal care homes, there's no interpreters, there's no one there to assist and help our Métis elders that have to be housed close to hospitals in urban settings.
The lack of any coherent policy for Métis Nation health is also evident at the provincial, regional, and local levels, and in frontline service delivery.
One of the biggest problems that we have in Manitoba for the healthcare system is they don't know who the Métis people are. If you look at the Premier and you look at the provincial government right now regarding the vaccine rollout, regarding COVID-19, they're forgetting who the Métis people are. There's no programs, there's no services, they're not mentioned in any of their planning or anything whatsoever.
Systemic racism and discrimination have a profound impact on Métis people, both accessing and receiving care in Canada. We've had so many really strong examples of that during this pandemic, from the standpoint of even accessing COVID testing.
There's also massive racism when we have to use the ambulance system and we have to get into the hospital. The immediate question that always comes up in hospitals and provincial hospitals, what is your treaty card number? Are you First Nations? Who is paying your bill?
We are learning more about the investigation into startling allegations of a racist game being played by hospital ER staff.
Here in British Columbia, we brought to light racism in the healthcare system against Indigenous people when we heard that there was a game being played on guessing the alcohol levels of Indigenous people when they came into the emergency room.
We were flooded with calls the day we broke the story and days following, and so we recommended immediately a tip line so people can feel safe calling in and not worrying about being re-victimized.
This is the tip of the iceberg. These are very serious issues and they're ongoing issues. Things have to change.
Provincial governments have a leadership role to play in eliminating systemic racism against Métis in our health systems.
The BC government took swift action in appointing Mary Ellen Trappel-Lafond into investigating systemic racism in the healthcare system. And she's gotten a report, a great report, and how we can move forward in British Columbia and hopefully in other provinces to stop systemic racism in the healthcare system against Indigenous people.
The transformative change required to address systemic racism in our health systems must begin with strong federal leadership and legislation backed by resources. The proposed legislation for Indigenous health and for the United Nations Declaration on the Rights of Indigenous Peoples provide important opportunities through which to address the systemic racism and discrimination that continues to place the health and well-being of Métis people at risk.
Then let's ask ourselves, what can government do? Well, there's certain things government is doing right now, which I'm very proud of. The Prime Minister of Canada right now has already introduced that there will be a health legislation that will be passed in this country under his leadership, under the Liberal government, which will include the Métis people. That definitely for us is the beaming light.
Engaging the Métis Nation and other Indigenous leadership throughout the development of the legislation and associated policy frameworks will be essential to their success, as will the active engagement and commitment of leaders and decision makers in the provincial health systems. Legislative and policy change must be accompanied by concrete Métis Nation-specific action plans that provide for appropriate oversight, management support, and accountability for Métis Nation health at all levels within the health system.
So when you look at that part of what needs to take place, what can governments do? Well, the first thing is treat us equally. End the days of discrimination against the Métis.